some instruction before starting the session. Please ensure that your audio and video are on working condition as soon as you log in. The microphone should be muted and the video should be off from start to end. If you do not obey this, you will not be allowed to continue in the session. You can raise your questions at chat during the webinar and will be answered in the question and answer session. Each question will be monitored by the chair and will be answered at the end. All shall pin the screen of the speaker soon after the PowerPoint presentation is started by the speaker. The feedback form link will be provided in the chat box at the end of the session. Thank you.
Good afternoon to all. The COVID-19 pandemic has unleashed the worst global crisis in our lifetime. It's the greatest challenge we have faced since World War II. It has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, good systems, and the world of work. The economic and social disruption caused by the pandemic is devastating.
Responding swiftly to the pandemic while ensuring that humanitarian and recovery assistance reaches those most in needed is critical. Now it's a time for global. Only together we can overcome the intertwined health, social and economic impacts of pandemic and prevent its escalation into catastrophe.
In this current scenario, we, the Bioscience Department, Sci Guys of Indira Gandhi College of Arts and Science, is conducting a webinar in association with IQAC. As world needs leadership and solidarity to fight this global crisis, we consider this a humble effort from our side.
Firstmost, a very big thank you for your time. Thanks for joining us. We have a doctor for excellence with us to talk this in detail. Let me extend a wholehearted welcome to all of you on behalf of Indira Gandhi College of Arts and Science. So, without further, let's get into a session with a silent prayer.
Now, it's time for us to formally commence today's webinar. So, to kickstart the event, let me invite Professor Jyoti Ma'am, HOD of Department of Bioscience for the webinar address. Ma'am, please.
Thank you. Good afternoon, everyone. I'm extremely happy to welcome all of you to this webinar. Hello, I'm COVID-19. Nice to meet you. Organized by the Department of Bioscience in association with IQAC. Before we get started, I would like to express my sincere appreciation to all of you who generously worked to make this event come to a success, especially Professor Varsha, Professor Harita, and department technical coordinators. First of all, I would like to welcome Dr. C.V. Thomas, Principal, Indira Gandhi College of Arts and Science. Due to unavoidable circumstances, he could not join with us, sir. Still, we know that your support will guide us to conquer heights in future. The webinar today is led by a great resource person, Dr. Shruti K.M., Associate Professor, Department of Anatomy, ACS Medical College and Hospital, Chennai, who will be giving us a presentation on the invisible enemy, who is brilliant, tough and smart, none other than Corona. Put our survival in question and prompt us to fight and thwart the natural theory. Only the fittest will survive and struggle for existence will eventually win. Let's lend our ears to the words of an expert and ma'am. On behalf of the college, staff, students, and all the participants, I welcome you. The next persons to whom the welcome should go are Mr. Badusha Bashir, our Administrative Officer, and Professor Sajid A.M., our IQAC Coordinator. Warm welcome to both of you. Last but not least, I should welcome all the staff, participants, and students who are the real strength of our college. Welcome all of you to this wonderful webinar. Once again, a hearty welcome to one and all present. Have a nice day. Thank you.
Thank you, ma'am. A strong motivator for both students and teachers who inspire us in many valuable things, who really make a try in building up a good future for each one of students' career. I welcome our beloved principal who has become the pillar of Indira Gandhi College within days. Now, I welcome the principal of Indira Gandhi College of Arts and Science, Dr. C.V. Thomas sir, for his principal address. I welcome you, sir. Because, be- because of his busy schedule, he couldn't make up to the program. So, thank you, sir.
Now, we are moving to the key part of our session. I, on behalf of everyone present here, heartily welcome the guest of honor, Dr. Shruti K.M. Ma'am, an associate professor in Department of Anatomy at ACS Medical College and Hospital, Chennai. She is an active member of Medical Education Unit in college, which focuses on implementation of new curriculum to undergraduates. She has completed MBBS from Government Mohana Kumaramangalam Medical College, the Tamil Nadu Dr. MGR Medical University, Salem in 2009. She has pursued post-graduation in MD Anatomy from Amrita School of Medicine, Kochi in 2015. One of the great achievements is that she has represented India in Asia Pacific swimming competition held in Malaysia in 1996, having obtained more than 500 medals in various individual events in swimming at district, state, south zone and national level swimming competition. She has also actively taken part in several seminars and journal clubs conducted by the department. So, with immense pleasure and proud, I invite Dr. Shruti K.M. Ma'am for the further session. Ma'am, please.
Thank you, Dia. Thank you so much. Can you hear me? Am I audible?
Yes, you are audible.
Yeah, ma'am.
Introduction, and thank you, Dia, for doing your job great. So, I shall present my screen now. Yes, I hope my screen is visible.
Yes.
Yeah, ma'am. Visible.
Yeah, thank you. So we'll just walk. I think I don't have to tell you anything new about COVID or Corona as such. We are all been living with it, and we are all experts in it today. So we'll just have a casual walk through this session and have a look at what is this COVID-19 in a little bit depth, because you are students of bioscience. I think you will have pretty good or decent knowledge on this. So going forward to how we are going to look into this COVID, who came and gave us a nice handshake and spread among each and every one of us so fast that we're still thinking, where did one whole year just disappeared in front of us? So let's look into our topic today. So I think every single person in this chat room are like super duper big COVID experts. Uh, we are all expertise. We know what is the disease. We know where it came from. We all know the symptoms and stuff. Still, I'm going to walk you through the same story. Maybe something might be new, something might be the same old story. So let's just start off. So we all know where it started from, right? Obviously, anyone wants to tell me where it started from? You can unmute and tell if you want. The birthplace of COVID-19.
Wuhan, China.
Yes, it's from Wuhan. Yes. So it started off from Wuhan. And who was the hero who started the entire episode here? Who's the actual hero? Anyone wants to tell that? Who's the actual hero who gave us the infection? Yes, we all known this person here, right? Mr. Bat. So this
Yes.
Mr. Bat has extensively been carrying this specific strain of coronavirus, which when got this virus when adapted to living into a mammal. This is a pangolin, and it is a mammal which is facing extinction. So this virus mutated, entered this mammal, and through this mammal is the actual source that is seen to trace out that we ended up having COVID scenario today. So the very first set of cases happened in a fish market in China, that is Wuhan, and that was in December 2019. And in January 2020, we got it in India. Like it was like a massive outbreak. So if you can see up in the topmost corner of this, you can find this is the entire cycle. So this virus that is actually called SARS virus. The SARS-CoV virus is seen in bats exclusively, but they will also live in wild animals as well as in domestic animals only after they get mutated. So there'll be bats that drop, eat food and drop, or their droppings. All that will be that one source where the virus could enter into these animals, and by chance, if we consume or we are near and around these animals, we are the end up receiving the same infection. So that is how this hero of our entire situation has taken us to. What happened after that? Then it was just unstoppable. It is just, the cases just shot up in like no time. Even before we could like breathe in and out, it spread everywhere in the world and was just totally out of control. And why it actually went out of control is because this incubation period being so short. That is it. Incubation period, anybody wants to say what the incubation period is?
14 days.
Yeah, what is it? What is incubation period? It is 14 days. Excellent. Incubation period is the time duration where the virus is going to enter into your body, nice, make its own house, settle down, and then starts its work. Okay, so you just after, immediately after you get exposed to that virus, the virus makes itself very comfortable in your body, and you start to the cells in your body start to replicate the genetic material of that particular virus. So in 14 days, it was getting transmitted so quickly that it was like an entire minor atom bomb or bomb blast that happened throughout the world. Yeah. So end result, we were all stuck at home. The big lockdown was put, stayed home. We washed vessels, we cleaned, the kids were locked off. Everything went virtual. Happy for the students. All of you were enjoying, switched off your video, muted your audio, listened to your faculty teaching classes, and you will probably sleeping or watching something else at the back. So life just reversed for each and every one of us at the end of this period. I mean, still it is still coming back to normal though, and this was the new normal that we actually took up, right? We don't even see each other's face smiling. All that we see is nice colorful mask which is matching to our clothes, and friends can't greet each other this way, though yes, we don't follow rules, but we have to keep a distance. People who used to be close, if they are scared, that's it, they all are gone, so they maintain their distance. So this is what has actually taken us or brought us in right now. We are totally in a new era with new habits, with new lifestyle, and all this did was started with a small teeny weeny virus. So yes, now we all know how the virus looks like. All of you have seen the picture. Virus is lying, each and every ad will have this coronavirus on it. So basically all the virus will have a similar story. Like they will be having an inner core material, and on the outside they will have these protein fat envelope with protein receptors on it. So almost all the viruses have a similar look of it. So this pretty virus has a crown. It has a look like it has a crown on itself. So that's why they call it coronavirus, because corona in Latin means crown. And because of those rounded ends that you see, it represents these spiny things on the virus. So that's how they called it the coronavirus. And actually, you have to remember in mind that it is SARS-CoV-2 virus. structure. It is having entire genetic material in the center. It has the main genetic material is RNA. It has a fat filled envelope, and it has some protein receptors sitting on these envelope. And there are several types. Okay, there are so many types that are seen. You find some in animals, you find some in humans. There are wild animals have a different type. Domestic animals have a different type. So but still it's such a mystery that, because we already had an episode of SARS-CoV. Okay, SARS took place in China in 2003, and the source was cat. We contained that. Then came MERS. It started in Saudi Arabia 2012. Camel was the hero there. We contained, curtailed. SARS-CoV-2 came after that, and still we are absolutely at shock, or we are not able to curtail this content, or this tiny virus, because so it still remains a mystery that how uh, this virus is evolving in different forms, and we end up giving them new diseases, and God knows what it's going to end up. I mean, it's going to come in the future too. So there has been older histories, and yet we are still at the stage where we cannot actually tackle it. So, what this coronavirus has done, I think all of you would have had somebody in close relation to you with the symptoms and something. Anyone wants to communicate and tell what kind of symptoms you get for this in COVID? Anyone, casually?
Ma'am, you lose sense of taste
Sure.
and smell and all.
Yes, good. So the loss of smell is a big thing that is happening right now. The problem with Indians are, if I tell you the list of symptoms, in the next 5 minutes, we'll all have the symptoms. That is the biggest problem faced in the Indian population. Probably everywhere, but more likely it will happen, and especially we Malayalis will definitely have that issue. If at the end of this thing, if I say fever, dry cough, and fatigue for 5 minutes, I think there's somewhere in the next 2 days you'll feel feverish. You might have a dry throat, or you might feel tired, and that is how we just tend to lose track of the originality. So the symptoms that we're looking at is fever, dry cough, and fatigue. Fatigue means tiredness, kind. You just feel lazy, but original laziness alla, it is actual laziness. So when you look into fever, it is not like high peak fever and all. It's just very low grade fever, and it lasts for around 4 to 5 days mostly, and the temperature is around 100.4 Fahrenheit or 38 degrees Celsius. And at times the patients have history of chills. Shivering happens along with fever. So that is the classical representation of fever in case of corona. And the next common problem is myalgia. Entire body is paining. You're so tired, and head is blasting with a headache. So this is another set of symptoms that has been very commonly seen in these patients. Sore throat. Okay, some dryness of the throat begins with dryness of throat. Then the person also has respiratory symptoms, and
Hello, ma'am. Hello. Hello, ma'am. Are you there?
Due to some technical issues, she cannot be here. So please wait for a few seconds. She will be online soon.
I am so sorry for the inconvenience. Um,
It's okay, ma'am.
yes, can you see my screen now?
Yes, ma'am.
Yeah, so where did I stop? Which symptom till where did you people see the screen?
Till the symptoms for ma'am.
Okay, I mean, okay, overall you don't know the symptoms, right? So fever, dry cough, and fatigue are the usual symptoms. To be more specific, fever, it is around 100 degrees, 100.4 degree Fahrenheit with chills, common kind of common temperature, and which the fever is usually low grade fever. And if you see, there is also myalgia here. Myalgia, as in there is body pain, there is fatigue, and there is severe headache. So that is very commonly seen here. And the other respiratory symptoms include there is sore throat, running nose, nasal congestion, dry cough, breathing difficulty, pneumonia, acute respiratory distress syndrome. So if you look at this, the common ones are sore throat, running nose, and nasal congestion. There's dry cough also. Breathing difficulty is in a later state, pneumonia, and acute respiratory distress syndrome. All those lower three are towards the final stages. Apart from that, there is a lot of patients that have come across loss of smell and taste, and some of the other symptoms are conjunctivitis, nausea, vomiting, diarrhea, rashes, and chest pain. Very common ones. Okay, so um, if you look at all these symptoms don't come in all of them. Okay, just it is these symptoms when comes in different proportions is how the severity of the disease is classified as. So when you look at the different type of classification, you can see that there are people who can be asymptomatic, meaning the person is positive with a COVID infection but no symptoms. You won't even know they have an infection. It could be pre-symptomatic. The person has the infection and just mild, it's just on the starting end of going to show symptoms. It could be mild, moderate, severe, or critical. So if you see asymptomatic person, WHO has recently declared that asymptomatic person do not transmit, or there is no active transmission of infection through asymptomatic person. Still, it is not completely recorded or substantiated regarding that. But the pre-symptomatic period, so there is a very faint line between asymptomatic and the pre-symptomatic period. So a person in the pre-symptomatic period is they have more possibility to bring about a transmission of this infection, an active infection. So the next category comes to mild to moderate. So this category, more than 80% of the population belongs to this category. They have some symptoms and they can be managed at home with minimal medications. So very rarely they might have a little bit of pneumonia. I think we all would have been very familiar with pneumonia. We have a lot of pneumonia cases in India per se. And if you go on to the next stage, if you go to the next stage, uh, uh, there are around 15% come under this, that is the serious category. That is, they are more of a severe per se, a person with symptoms like they are around 15% of this come under this category. Dyspnea, that is, they have very they have some kind of difficulty in breathing. That is, the difficulty in breathing is called dyspnea. And there are a case of hypoxia where the saturation, the oxygen that is entering into their bloodstream and reaching their lungs, the percentage is very highly reduced, and there is more than 50% of damage that has actually happened to the lung in this group and of these cases. So this comes under the severe category. And whom do we call they are critical? Very few people, that is around 5%, go into this case, this category, because they have a respiratory failure. The lung refuses to respond and just collapses. No expansion, no relaxation happens. So there is no entry of air into the lungs. And because of that, there is shock. And shock as in the system is panicking because there is no oxygen go supplied. Just imagine there is no oxygen. The only source of oxygen that we are taking into our body is breathing in. And when that oxygen is not entering, every single cell is dependent on that oxygen. So that entire this shock is multi-level functional disconstruction that takes place inside the body system. So, and after that, all of the organs just tend to give up and they go into a multi-organ failure. And so this is how you will group these COVID positive patients. So most of us will be actually probably right now, maybe you and me are just in the asymptomatic category and we don't even know that. So we wouldn't even try to even find out if we are positive, right? Unless and until coincidentally, if you're required to do a test and we turn out to be positive. So if you want to look at how the onset of illness happens, so depending to say that this person is mild to moderate, severe or critical. So when the person has kind of little difficulty of breathing, that is up to 5 to 8 days, there is some minimal amount of difficulty of breathing, we can say it is mild to moderate. Okay. When there is a acute respiratory distress syndrome, that is the saturation level of your lungs or the oxygen level in your body, that is what they say, check, no, the SpO2 has just drastically coming down, and that could happen from the 8th day of infection to your 12th day. And most of the patients just who have gone into acute respiratory distress syndrome have to be shifted to the ICU. By the 12th day, they are already in the ICU. So if you're infected, if you surpass infection, it is like a piece of cake. But if it doesn't happen, then you might be in the ICU even before you realize that you are in there. So who is actually vulnerable to these infection? Anybody who's immunodeficient. They say old people are vulnerable, yes, because their immune system is down. But to my knowledge, I think people of the adolescents and middle age group people of the current genre, they do not have any sufficient protocol in their life that could keep their immune system high. So probably, to me, I would say the older age group are still better than us. And apart from that, some senior citizens or any regular person, an adult with hypertension, diabetes, any cardiac complications, any lung disorders, chronic like asthmatic or some bronchitis, and renal failure patient, they're all the ones who are usually prone to get this infection really fast. Or even if they get the infection, the time for recovery is longer for such case of patients. And to see who's safer among all, the kids and the pregnant women, for one reason being that the kids have when the kids have an extra organ till puberty, they have an organ called thymus inside their body. So thymus is responsible for protection of extra cells, that is the lymphocytes in your body, the T cells, T helper cells that will help in accomplishing or destroying any pathogen that is entering into the body. And secondly, pregnant women, automatically the immune system is higher up, in need of the body to protect the baby inside. So these are the two age group that are currently on the safer side. It doesn't say that they will not get infected. They will get infected, but however, the recovery is, the symptoms are very mild, the level of infection is very mild, and they recover really, really fast. So yes, this is the common group. And of course, all of you know how transmission is happening. So if you are on meeting somebody with a COVID positive and you don't know, of course, and you shake your hands or they're talking, the saliva is falling on your face, you're spitting and you're touching on the place where there is a spit, that is called droplet infection. And through that, I mean, droplet transmission. And that usually happens with direct contact. And suppose if you are in a room full of people, hundreds of people, and there is one COVID person, I hope you all know, I'm not that one main instance that was highlighted in the beginning in India too. I'm not going to say that is because of an aerosol transmission, because there is air particles in the room was carrying the COVID-19 virus, the coronavirus itself. So that is another type of transmission, that is aerosol transmission, that usually happens indoor. And now if we have seen the symptoms, we have seen who and all gets it. And diagnosis, I think you guys might be familiar with the term RT-PCR, that is real time polymerase chain reaction, and usually done, and it is reliable if it is done within 7 days of infection. Okay, and usually we do it with a, right now we are all doing a nasopharyngeal swab. We just stick a swab into the nose and take the secretions inside the walls of your nasal cavity, and they just put in into a PCR machine, and they break down the genetic material of the virus. And there are some sensitizing agents that picks up these viral components, virus components, the genetic material of the virus, and it turns, and if it's positive, we are all COVID positive. And apart from that, blood parameters, nobody is directly going to do your blood parameters unless and until you're admitted or you are at greater risk. They just look for parameters where you have some kind of changes in the count of your blood cells. So lymphocytes are reduced, there is increased number of neutrophils, and the some of these enzymes, okay, serum alanine aminotransferase and aspartate aminotransferase are all elevated. C-reactive protein, that is a protein that raises with some allergic reaction in your body. These are all are all things that we will note only once we have been detected with COVID positive, and you can say they would do a blood profile. So that is how you'll end up seeing blood parameters. And apart from RT-PCR, the most dependent test is a CT chest, an imaging of the chest. So in a normal pneumonia itself, the feature that you see in pneumonia is this, that is the ground glass opacity. And then if you look at the picture A, it is a normal lung. And if you look at picture B, can you see the difference of this? You have seen ground glass, you know, windows, they use these glasses that has mild shading, that is called ground glass opacity, and that's how the lungs end up looking. And in COVID patients, it is just unstoppable. Day one, they will look absolutely normal. Day two CT chest, if you take, there is just massive changes in the lungs. Day three, you'll be shocked. You wouldn't even expect that person to get this worse. But on the outside, he would actually look stable. And that is why most of the practitioners got misled to understand, thinking that this patient is stable. But on the fifth, sixth day, the person just goes into respiratory failure. So very unpredictable virus when it comes to the ones who really fall victim to this. And some of the other tests that have also been practiced is, one is antigen testing. What is an antigen? If a virus enter into my body, uh, the protein in that virus is the antigen, and my body understands that it is an antigen, it is a foreign body inside my cell, and this wants to destroy it. Then it produces this one, that is an antibody. So to detect the antigen is known as rapid diagnostic test, and it is a cheaper test, but it is not very reliable, so they don't really do it much. Other than that, the antibody testing is more reliable. Again, this has not been followed because not everyone have been tested antibody positive. So if there is antibody in the body, that means that that particular person has been tested positive for COVID and has finished, that infection is done. So RT-PCR positive means the person is currently infected, and antibody positive means he's finished with the infection and he's moved forward. So quick look at how much the treatment is taking part. Yes, so all of us are medical practitioners at home, and we are so lucky that we are in India. We have this custom of using all these contents in our cooking, so we have that potential to actually tackle this virus, because all of these, that is turmeric, neem, ginger, garlic, lemon, fenugreek seed, cinnamon, pepper, water, honey, amla, all are just secret magicians that actually work from the inside and help us, just combat this particular virus by increasing the immunity. We are not killing the virus directly with these structures. Our body immunity is raised up so that we can fight this virus in our body. And this was one thing that actually helped people in India. COVID-19 struck India during summer season. And if you see the European nations that went into a second lockdown, it all happened when the temperature was sub-zero, minus. So it was easier for the COVID virus to actually sustain that temperature and mutate and actually affect the people there. But in India, hot summer, and that is one of the main reasons that we could actually prolong for the number of population. We are still not in a bad scenario. Our death rate is not as bad as it could have been. I mean, imaginably it could have been a really bad thing, but currently we are lucky enough that nothing of that sort has happened. And apart from this, what are the other medications used? Everyone just jumped in for treating COVID-19, right? Allopathy people, I'm the best. Homeo, I'm the best. Ayurveda, I'm the best. Siddha, I'm the best. Everybody has been best. But to be frank, all of them together have actually brought about a really good outcome. Allopathy has given out its own contribution. Homeopathy has given its own contribution. Ayurveda, in turn, has given its contribution, even Siddha. So all of them have their own particular speciality. No one has worked individually. It has been a combo treatment that is actually elevated, the thing. So if you look into the allopathic treatments, it was mainly that they gave were paracetamols. That was to reduce the fever. Antibiotics were given, but please understand that antibiotics do not kill a virus. Antibiotics is used to kill bacteria in the body, and antibiotics here are given because, and virus, how it acts is, the virus will go attack your immune system, and once the immune system is down, what happens? Neighboring infections will all be waiting to enter into your body and attack. All the bacterial infections will enter. That will ruin your entire stability, and you end up getting several other infections. So that is why antibiotics are actually administered in this case. But we all, in general, we just end up having a we all want to have an antibiotic if you have a throat infection. That is a false things that we have always been following. And supplements like vitamin C and zinc have done just wonders in bringing up your immunity. And this was one very efficient treatment that is still being followed, dexamethasone. It is a steroid, and it is actually administered to really critical patients, and it has shown real good effects also. And the same way, homeopathy. I think you would have all heard this arsenic album. This is actually that metal arsenic, and that is given in dilutions, and that has actually been reported to really increase the immune response. Beyond this, each of these treatments have been classified as per the severity of the disease. All right, so it is not. It is a generalized. I've just put up everything together in one. So it needs to be done in the right proportion and the right time for the right group of people. So it is not a very specific slide that I've put forward. And what we Indians have gone into is this herd immunity. Herd immunity as in, like, we have been all let loose. We are all sitting in the same room. We don't know whether the person inside the room is infected or not, but we're all in the same room. And herd immunity is of two ways. One is by vaccination. You vaccinate most number of people in the room, you have herd immunity. Number two, you allow most of the people in the room attain the infection, and that's how another set of herd immunity is attainable. So these are the general perspective on the treatment per se. And what I personally believed is, the ones who didn't bother, the ones who didn't know about this infection, were actually the safest and the strongest. Somehow, I think um, they were the ones involved in this scenario pretty seriously. And I would also like to give a small reflection on this particular presentation, that there is what is the difference between a quarantine and an isolation. A quarantine is if the person has been infected and you know it, then the person goes into quarantine. If the person is already positive, then you go in for a isolation. So this is the two terms that you have said. You are in contact with a person who is infected, and that person goes in for a quarantine. If you are already positive, you call it as an isolation. This is something a lot of people have asked me also, so that's why I just put forward here. So, and this is one more thing I would like to include, that breastfeeding does not actually, that is, if the mother is positive and the positive mother breastfeeding the baby, is been declared in the WHO that it does not spread COVID virus down. And again, kids below 5 years do not require a mask. And plus, the antibody and immunity, I mean, the ones who that is sorry, the kids from 6 to 11 years of age, they also need not wear a mask, but depending on the area, if there are area has too many cases, then the kids have to have they should adore a mask on. So that is two areas where, again, when I take my kids also, they all look, if they don't wear a mask, my younger son, they're like just staring at me like I'm this bad mother. So this is the overall outlook I would like to give on this scenario. Sorry, one second. Sorry. Is my screen visible? I think I've lost. Hello?
Yes, ma'am, you're visible.
Okay. I am so sorry. I think I have some problem with the presentation. So I'll just tell you, I'm not, the thing is not going. So right now, the vaccines that we have, right now, the vaccines that we're looking at is two vaccines that are available in India. Okay. One is Covaxin and one is Covishield. And we're in a war finding out who's better. What is Covaxin is better or Covishield is better. So Covishield is basically from Oxford, and Covaxin is actually that is being manufactured by Bharat Infotech, that is in India, that is biotech, sorry. And if you see Covishield, it has been tested. Okay, there are three phases has been tested. That is, there is a phase 1 trial, phase 2 trial, and phase 3 trials that has to be done. Phase 1, around 100 patients will be tested, volunteers. Phase 2, around 1000 will be tested, and phase 3 it goes to several thousands. So Covishield has actually done it in several thousands of patients, and because of that they say that this vaccine is 70% efficacy is present in this vaccine. And Covaxin, however, phase 1 and phase 2 has been completed is what they have said, but unfortunately they have not provided any hardcore data, so we don't know what is the truth behind it. And so again, it is a mystery. So in short, what is our duty right now again is that we maintain social distancing. We have masks on for a longer time. If you are going to larger groups, please wear your mask and go ahead and wash your hands regularly. Carry your own hand sanitizer, and I believe that's the only way we can actually, overcome this entire episode. So I would like to end my presentation here. I think I've taken too much of my time. I'm really sorry for the inconvenience I created. I'm open for questions. If you need any questions, we can go in for discussion.
Ma'am, we have few questions in the chat box.
Okay.
Ma'am, can I read it for you?
Yes, please. It will be nice.
Okay. Ma'am, what are the post-coronal symptoms that can happen to a patient with minimal symptoms?
A post-coronal patient actually doesn't give too many symptoms. They kind of, fine. There is mild recovery issues that happen. That is, the patient is, having issues to, come back to normal. Like after you have a fever, that's exactly what happens. You're tired, you're a little thing, and you'll go back into normal life. So there is not any major side effects that is seen in, mild infection cases.
Okay, ma'am,
Yes,
thank you.
yeah.
Ma'am, next question. Can
Mm-hmm.
COVID-19 affect the animal species?
What did you say? COVID-19?
COVID-19 affect the animal species?
Yes. There are a lot of species. Uh, there are.
Excuse me, ma'am, you're not audible.
Hello. 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 ಇಲ್ಲ? Hello, ma'am. Hello. 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 Hello.
Where did we leave? Hello?
Hello,
Yeah, yeah.
ma'am.
Please, please. What was the question? Yeah, you were talking about animals having infection, right?
Yeah, can COVID-19 affect the animal species? That was the
Yes,
question.
yes. As in, each the COVID can evolve in every single species alive. So, as of now, there are a set of domestic animals. They have actually been present, but they don't manifest to humans. But this one particular strain has evolved, and that has only reached us. No, so there are a group that infects the wild animals as well as domestic animals. Yeah.
Okay. Will the overuse of sanitizers create more problems like more resistant virus?
Sorry, sorry.
Will the overuse of sanitizer create more problems like more resistant virus?
No. No. Sanitizer we're using only on hand. No, we're not swallowing it. So resistance is basically coming from our body. So overusing of sanitizers, however, injuries, bring about injuries in the epithelium of your skin. So right now, if you say, they also say, please moisturize your skin with overuse of sanitizers also. So sanitizers don't, interfere in, the genomic material of a virus. Yeah.
Okay, ma'am. Next question is, ma'am,
Mhm.
is there any chance of recurrence to an affected person?
Is there any?
Reoccurrence to an affected person?
Yes, there is history of reoccurrence. There are doctors who have been retested positive. So this was one thing I wanted to include, but I didn't. It is there in one of the slides, I guess. Antibodies are being produced in the body after that. Is, if I have a COVID infection, I will have antibodies to it, but we don't know for how long these antibodies are active. So that is the biggest question mark. So just because you get once, it doesn't mean you will not get again. You will get again, but you don't know when will be your second episode. It could happen immediately for some people. There has been span of 6 weeks, and the person has already got a second episode. So yes, there is a possibility of a second infection. Yeah.
Next question, ma'am.
Mm-hmm.
Covaxin have any side effects?
Yeah, both of them have their own thing of side effects. If you see Covaxin, they have not registered the side effects on the clinical trial aspect. So, Covaxin, what they are saying is, of course, like any other vaccine, there's going to be fever and body pain is happening. So, there are some rumors that came in between that it causes brain damage and all, but however, nothing is recorded when it comes to Covaxin haven't really been very transparent with their side effects. So apart from that, yeah, body pain, headache, all that has occurred in Covaxin case. Yeah.
Next question, ma'am.
Mm-hmm.
Ma'am, can transmission of coronavirus occur from food, food packaging, or food containers and preparation areas? This is from Dia Jason.
Uh, no, that is food containers, yes. Cooked food, no. To a particular temperature, COVID virus cannot sustain warmer temperatures. So anything that is cooked is safe. But yes, the container is very, very dangerous. COVID virus will sustain in wood and paper material for a longer duration, up to days also. So plastic or paper or wood, it will have a virus sitting in it. So yes, you will get it from the containers, not probably from the food. And if whoever is handling the container, yeah.
Okay, next question is from Bhiram Nair. The
Mhm.
question is, I had COVID, but still I cannot recognize taste and smell. What is the reason behind that?
Hello?
Uh, this
Hello?
uh, this virus, what it does is, uh, we have this nerve endings inside our nose that is responsible for smell. So this virus will go and cover there is a surface epithelium covering that nerve endings in the nose. So this virus will go and destroy it. Same thing happens with taste. Your taste buds are actually nerve endings, so it will go destroy those nerve endings. So that covering of the nerve ending, so it takes time for that covering to come back. And it depends on each person to person. Once again, if you have supplemented yourself with good amount of vitamin B and vitamin E or zinc, healing happens really fast in your body. So if you are a little on the weaker side, it will take longer time for you to retain back your smell and taste. Yeah,
Thank you, ma'am.
thank you. Yeah.
As we are getting out of time, we will end the
Yeah.
question and answer session and wrap up with the feedback. For the
um
feedback
I,
session,
I would really like to apologize for the inconvenience from my end. I'm very sorry. I hope it was not a pain for you guys. Yeah.
it's okay, ma'am. Your class was very interesting and thank you for your valuable section. Okay, for the feedback session, I welcome Anaga KS of second year BSc Biotechnology. I welcome you.
The novel coronavirus disease or COVID 19 pandemic is a defining global health crisis of our time and the greatest challenge we have ever faced since World War II. Since its emergence in Asia in 2019, the virus has now spread to every continent. But the pandemic is much more than a health crisis. It's also an unprecedented socio-economic crisis, stressing every one of the countries it touches. It has the potential to create devastating social, economic, and political effects that will leave deep and long-standing scars. Even though several vaccines have been developed and several countries have initiated mass vaccination campaigns, preventive measures are still employed, which consist of physical or social distancing, quarantining, ventilation of indoor spaces, covering coughs and sneezes, hand washing, and keeping unwashed hands away from the face. The use of face mask or covering has been recommended in public settings to minimize the risk of transmission. It will require all of society to limit the spread of COVID and to cushion the potentially devastating impact it may have on people. Today's webinar was full of knowledge and interesting things. It gave us deep insights into the topic and also revealed some interesting facts. At this moment, I would really like to thank Dr. Shruti ma'am who made time for us to explain much information about COVID-19. The point where ma'am told us about the efficient treatment method to tackle COVID-19 using home remedies and other medications was really informative. And it was also interesting to know more about the symptoms and its diagnosis. I am pretty sure the knowledge which ma'am gave us will definitely help us in our future and studies.
Thank you, Anaga. Next, I welcome Aishwarya of first year biotechnology. I welcome you.
Good afternoon. I would like to thank our beloved Shruti ma'am for such a wonderful and delightful session. This talk was most effective and made awareness for people to regarding the COVID-19. This talk created a great confidence in fight against COVID-19. Vaccination is the administration of vaccine to help immune system develop protection from a disease. It's the most effective method of preventing infectious disease. Covaxin, India's indigenous COVID-19 vaccine by Bharat Biotech, is developed collaboration with Indian Council of Medical Research, National Institute of Virology. I found this meeting really helpful and the session was most enjoyable and highly informative. Thank you, ma'am. Thank you so much.
Thank you, Aishwarya. Feedback form is given in the comment box. Participants kindly fill the form as soon as possible and e-certificate will be provided within 2 weeks.
Gratitude is a fairest blossom which spring from soul, and it is a memory of heart that will recognize the good done. So, to share the heartful gratitude, I welcome Professor of Bioscience Department, Harida VS, to deliver her speech. I welcome you, ma'am.
Good evening, everyone. I am Harda VS and I am here to present the vote of thanks for today's webinar. Respected and our most distinguished chief guest of the day, Dr. Shruti KM, respected Principal Dr. C.V. Thomas sir, our beloved HOD Professor Jyoti ma'am, honorable professors and my dear friends. I deem it to be a great honor to propose the vote of thanks to all who have helped us in making this webinar such a resounding success. First of all, I would like to propose heartily vote of thanks to our chief guest, Dr. Shruti ma'am, for gracing today's webinar. Thank you, ma'am, for your excellent presentation and making this webinar an interesting and informative one. I would like to express our profound gratitude to our principal, Dr. C.V. Thomas sir, for all the support in organizing this webinar. I would also like to thank our beloved HOD, Professor Jyoti ma'am, for her moral support and guidance. I am happy to express vote of thanks to our staff members, especially to our one and only male staff, John sir, for all the technical support and making this webinar a grand success. I thank all the people who have participated overwhelmingly and making this event a great achievement. Finally, the wonderful students who have turned up in such great numbers, not only from our department, but also from other departments of various colleges. Thank you so much for your cooperation. Once again, I thank all your cooperation. Thank you.
Thank you, ma'am. We all are extremely thankful to our beloved guest, whom when we approached with the invitation and requested to grace the event as the chief guest, did not hesitate at all and instantly agreed when looked upon the program. The presence of such a personality in this function is a blessing. We hope that the students and teachers are able to seek guidance and imbibe something from our thoughts. Thank you, ma'am. Thank you all for your cooperation and time. Thank you.